Okay, before I would start this procedure, I would go ahead and wash my hands, and then when I get into the med room, go ahead and put on clean gloves and go ahead and start getting my supplies together. My name is Ashley Cole. I'm going to go ahead and do this next skill of primary insertion or primary IV bag. Okay, so I've already inserted my line. I'm going to go ahead, check my MAR, make sure this medication is for the patient, make sure I have the correct dose, correct route, correct frequency, appropriate lab values for this. The white blood cell count was 12, so this person does need the vancomycin, which I do have my drug card for. Go ahead and verify the dosage amount, which was 500 mg reconstituted in 10 ml, which we're going to put into our primary 100 ml bag. Again, it's an antibiotic. Things to watch for with this medication: redneck syndrome if given too fast, so just slow it down. Nephro-ototoxicity to work with, and also to watch for, and GI distress with this patient as well. Need to calculate the drop factor. So drop factor for this tubing is 10, so you would just do quick here. 6 We did it right there. We did it right. No, we did. Quick calculations, 83 drops per minute. Okay, so now I'm going to gather all my materials together. I have to draw up first, before I do that, I have to draw up my flush. So 2 of those. We're going to pretend this is normal saline for the moment. There's 3. And then another 3. Okay. And now we're going to pretend this is vancomycin. I'll draw out my 10 that I need. Okay, so I have this drawn up. Okay, now I'm going to go ahead and mix it into my primary bag, which is here. So, this is a new one. Wait. Here. Okay, then I'm going to take this out and dispose it into sharps, but for skills purposes and reuses, I'll slide it to the side. Okay, and then the next thing that I'm going to do is place a label on this so that everybody that comes across it knows that it is for Mr. Smith, and it has vancomycin in it. Okay, so I have everything that I need to go into the room. Okay, so now I'm going to go into the room, knock on the door. Hello, Mr. Smith. My name is Ashley Cole. I'm your student nurse today. Going to go ahead and hang your vancomycin for you. Do you have any questions for me? No? Okay. I'm going to go ahead and look at the IV site. Also going to check for allergies. Again, I'll make sure he's not allergic to allergies, have him verify name and date of birth. I'm going to go in, look at my site, make sure it's not red, inflamed, or infiltrated. I'm going to go ahead and here, wipe the port off here. Go ahead and use one of my flushes. I can get rid of that needle. This is a needleless port. Okay, using Asha, I'm going to unclamp here and aspirate to return. I'm going to use push stop method, push stop, all the way in. ASASH method. Okay, and then for here, I'm going to discard of that, leave that there. I'm going to go ahead and take my primary, trim my tubing before I get this started. Actually, I should have done this first because this doesn't bleed everywhere. Shut off. This is all going to go in because this has been broken. No. Okay. Okay, so hanging in my bag. This has already been used, but prime this here. I'm going to prime my tubing. Make sure there's no air in it. Okay, making a mess on the floor. Perfect. Okay. And again, for all intents and purposes, I'm going to wipe this again just to verify that I'm doing it correctly. Then I'm going to take this and connect it here. Okay. And then to make sure I have the correct drop factor, I would count for a minute to make sure my drop factor is what it needs to be. Okay, so again, I would count drop factor. Continue to monitor the IV site as it's running, and then once it's over, I would disconnect or discontinue. Okay, and disconnect the tubing. I'm going to label my tubing with date, time, medicine that has been run through it, so the tubing does not have to be relabeled again or changed out. So date, time, initials, medicine that's in it, and when the tubing was placed on. Go ahead and pause it. Forget it. Okay. Once I have discontinued the IV, I would place a new alligator tubing on here, and again, have everything labeled. I'm going to take my next 3 ml flush, wipe this off again. Push stop, 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 all the way down. Clean that off. Okay. Excuse me. Okay, and for this one, if it was hospital protocol, I would use heparin for a central line if needed. And then for documentation, again in the MAR, record time, dose, route, the drug, the IV condition, when I started, when I stopped, volume of fluid used, which would be the 100 ml bag if it were to be completely, and I would also document the INO in the MAR as well. You can stop. No.
Gotta go home too, so
I know.
I'm not redoing that whole thing.
Okay, now I'm going to do for the piggyback. I'm going to go ahead and make sure I have all my supplies together. So can I put pads together? Get all of that out of the way. Draw up my, already have my piggyback ready. My vancomycin, again, reviewing what it's for, the side effects, what can happen, things of that nature. So I have that together. I have my piggyback tubing together. I have my tape, not that I really need it. And I already have a primary line infusing on the patient, or I would. I already have a primary line infusion on the patient, so I wouldn't need a saline flush. Okay, now we're back. Okay, so that would be running on the patient. Okay, so I have what I need. I verified that this medicine is for the patient, verified why they need it. So now we're going to go into the patient's room, knock, knock, knock. Verify who I am, the patient, by having them state their name, date of birth, put on gloves, let them know what I'm giving them, the vancomycin, as a piggyback medicine. Oh, that's gone. And I have a new, let's just use this one, as a label. So that one's on there. And we're going to go ahead and get this set up. Off. Fill this. Okay. Go ahead and hang this one. Then I'm going to apply my piggyback to my primary. I'm going to shut off. This one is here. Okay. Explaining everything to my patient as I go, wiping the port. Going to go ahead and get this set up here. Okay, and then for this one I would go ahead and set my drop factor to 83 drops per minute. Okay. And since this one is below, I have to open this one up. Okay. Okay. And I would monitor the site, make sure there's no redness, swelling, ask the patient how he's doing. I've already established the flow rate. So I'd watch and monitor, and once it's completed, I would shut it off. Shut this one off, shut this one off, disconnect, label the tubing if need be. And then what I would do is reset this to the, take this piggyback off, but I reset my primary infusion to the previous drop rate of what it was. Reset, monitor the site, ask the patient how they're feeling, monitor for any adverse effects of this medication, and teach the patient again to call me if need be. And then I would come in, document on my MAR, time, date, drug, dose, route, IV condition, when I started, when I finished, MAR intake and output, and volume of fluid infused in the patient.